Chikungunya is a mosquito-borne viral disease that has raised concern across the globe, affecting millions of people in tropical and subtropical regions. The disease is caused by the chikungunya virus, primarily spread by Aedes mosquitoes, which are particularly active during the daytime. Although chikungunya is rarely fatal, it can cause severe discomfort and long-lasting symptoms for many individuals. In this video, we will explore what chikungunya is, how it spreads, its symptoms, treatment options, and ways to protect yourself. Let's dive in. What is chikungunya? Chikungunya is a viral disease caused by the chikungunya virus, which is transmitted to humans through the bites of infected Aedes mosquitoes. The most common mosquitoes responsible for transmission are Aedes aegypti and Aedes albopictus. These mosquitoes are typically found in tropical and subtropical regions, and they are most active during the day, especially in the early morning and late afternoon. The disease is named after a word in the Kimakonde language, which refers to a bent or stooped posture. This is because the most prominent symptom of chikungunya is severe joint pain, often so debilitating that it forces individuals to adopt a hunched or stooped posture. Chikungunya was first identified in 1952 in Tanzania, and over the years it has spread to many parts of the world, including areas in the Americas, Europe, and Asia. The disease continues to pose a significant health threat, especially as global travel increases, allowing the virus to reach new regions and causing periodic outbreaks. How is chikungunya transmitted? The chikungunya virus is transmitted to humans by the bite of an infected Aedes mosquito. These mosquitoes typically become infected after biting a person who is already infected with the virus. Once the mosquito is infected, it can transmit the virus to others through its bites. It is important to note that chikungunya cannot be transmitted directly from person to person, but rather through the intermediary mosquito vector. Additionally, there are rare instances where chikungunya can be passed from an infected mother to her baby during childbirth. However, this mode of transmission is less common compared to mosquito bites. One of the challenges with controlling chikungunya is that the Aedes mosquitoes that spread the virus are very widespread. These mosquitoes are known to thrive in urban areas and can breed in small amounts of standing water, such as in flower pots, tires, and clogged gutters, making it difficult to eliminate mosquito populations. Symptoms of chikungunya. The symptoms of chikungunya typically appear within 2 to 12 days after being bitten by an infected mosquito. The onset of the disease is usually sudden, with high fever and severe joint pain being the hallmark signs. Individuals with chikungunya often experience intense joint pain that can affect both large and small joints, particularly those in the hands and feet. The joint pain can be so severe that it makes movement difficult, and in some cases, the pain can persist for months or even years after the initial infection. In addition to joint pain, individuals may also experience muscle pain, headaches, and a rash, which often appears a few days after the fever. The rash may start as small red spots and later become more widespread. In some cases, joint swelling may also occur, contributing to discomfort and limited mobility. Although the disease is rarely fatal, it can lead to long-term complications, particularly in older adults, newborns, and those with underlying health conditions. Severe symptoms can cause prolonged suffering, and recovery can be slow due to the persistence of joint pain. Diagnosis of chikungunya. If you suspect that you may have chikungunya, it is important to seek medical attention as soon as possible. The symptoms of chikungunya can be similar to those of other mosquito-borne illnesses, such as dengue fever and Zika virus, which can make diagnosis challenging. To confirm a case of chikungunya, healthcare professionals typically use blood tests to detect the presence of the virus. A medical history, including recent travel to areas where chikungunya outbreaks have occurred, can also help in making the diagnosis. Testing for other mosquito-borne illnesses may also be necessary to rule out other potential causes of the symptoms, such as dengue or malaria, which can have similar presentations. Treatment of chikungunya. Currently, there is no specific antiviral treatment for chikungunya. The focus of treatment is primarily on relieving the symptoms, particularly the joint pain and fever. Resting and staying hydrated are essential components of recovery, as they help the body fight off the virus and recover more effectively. Pain relief is commonly managed with acetaminophen, paracetamol, which can help reduce fever and alleviate mild to moderate pain. However, it is important to avoid non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, especially if there is a chance that the person might also be suffering from dengue fever, as these drugs can increase the risk of bleeding. For severe joint pain, which is a defining symptom of chikungunya, additional medications may be used to reduce inflammation and pain. In some cases, physical therapy may be recommended to help manage ongoing joint stiffness and pain that can last for several months. While most people recover within a few weeks, the persistent joint pain experienced by some individuals can significantly impact their quality of life. In rare cases, chikungunya may lead to complications such as encephalitis or heart problems, particularly in vulnerable populations. Prevention of chikungunya. Preventing chikungunya primarily involves protecting yourself from mosquito bites. The mosquitoes that spread the chikungunya virus are active during the daytime, making it crucial to take preventive measures, especially if you live in or travel to regions where the virus is common. One of the most effective ways to protect yourself is by using insect repellents that contain DEET, picaridin, or oil of lemon eucalyptus. Wearing long-sleeved clothing and long pants can also help minimize exposed skin that mosquitoes can bite. Additionally, using mosquito nets while sleeping, especially in areas where mosquitoes are prevalent, can provide an extra layer of protection. Another important measure is to eliminate standing water around your home, as mosquitoes breed in stagnant water. By emptying containers such as flower pots, bird baths, and tires that collect water, you can reduce mosquito breeding sites and lower the risk of an outbreak in your area. For those who have been infected with chikungunya, it is important to take precautions to avoid mosquito bites during the first week of illness. During this period, the infected person can spread the virus to other mosquitoes, which can then transmit it to other individuals. Chikungunya vaccines and ongoing research. Although there is no specific treatment for chikungunya, progress is being made in developing vaccines to prevent the disease. 2 vaccines have shown promise in clinical trials. The first is a live attenuated vaccine known as aegypti, which was approved in some regions in late 2023. It has demonstrated effectiveness in preventing chikungunya in people at higher risk of exposure. The second vaccine is Chikungunya, a recombinant vaccine that received approval in early 2025. This vaccine has also shown promise in preventing infection in those at risk, especially travelers heading to areas with ongoing outbreaks. Despite the availability of these vaccines, they are still in the early stages of global rollout and are primarily intended for individuals at higher risk of exposure, such as travelers to affected regions. Ongoing research into more effective treatments and vaccines continues to be a priority for global health organizations. Chikungunya and global health. Chikungunya has become a growing public health concern, particularly in tropical and subtropical regions where the Aedes mosquitoes thrive. In recent years, outbreaks have occurred in various parts of the world, including the Caribbean, Africa, Asia, and South America. As of 2025, there have been significant outbreaks in China, particularly in the Guangdong province, where thousands of cases have been reported. In addition to China, outbreaks have occurred in European countries, including France and Italy, which have seen imported and locally transmitted cases of the virus. This highlights the importance of mosquito control and public health awareness in preventing the spread of chikungunya. Ongoing research. Chikungunya remains a serious global health threat, And while there is no cure for the disease, there are ways to manage symptoms and reduce the risk of transmission. Preventing mosquito bites is the most effective way to protect yourself, and global health authorities are working tirelessly to improve vaccines and treatment options for those affected. Stay informed, take precautions, and protect yourself and your loved ones from chikungunya. By reducing mosquito populations and being vigilant about mosquito bites, we can work together to prevent further spread of this debilitating disease. Thank you for watching. Stay safe and healthy, and be sure to stay tuned for more health-related information in our future videos.